We'd like to thank Montecito Bank and Trust for their generous support in making Scam Squad possible. I'm Patty Teal.
And I'm Deputy District Attorney Vicki Johnson. Scam Squad is up next.
Sound off.
1, 2.
Sound off.
3, 4. 1, 2, 3, 4. Scam Squad.
Welcome to Scam Squad. I'm your host, Patty Teal, here as usual with Deputy District Attorney Vicki Johnson. And today, Vicki has a very special guest. I'll let her make the introduction.
Hi, yes, thank you, Patty. Today we have with us Julie Posada. And Julie is the HICAP Program Manager for San Luis Obispo and Santa Barbara counties. And I really think this is a timely appearance by Julie because it is open enrollment now for Medicare, and Julie's going to talk a little bit more about that and explain how that works and what the time frame is. So Julie, welcome. Thank you so much for coming on the show.
Thank you. I appreciate the opportunity, and always like to talk about HICAP and share what we do and help people be aware of what to look out for. So yeah, I appreciate the opportunity.
Well, Julie, let's start out by having you explain what HICAP is.
Well, HICAP stands for Health Insurance Counseling and Advocacy Program. It's a state and federally funded program. We're not affiliated with any insurance company. We don't sell anything. We don't endorse anything. We're here simply to advocate and educate anyone who's on Medicare, about to be on Medicare, or maybe a caregiver of someone who is on Medicare. We have throughout our agency, Central Coast Commission for Senior Citizens, is responsible for San Luis Obispo and Santa Barbara County. However, HICAP is throughout the state. So there is a HICAP in any county in the state of California, and they offer the same services. And there's also throughout the United States called SHIP, and that is a federally funded program, which is similar for the other states. Basically, what happens with HICAP is that we have two funding sources. One is state HICAP and one is federal SHIP. So we do receive funding from both. Anytime someone receives information from Medicare or IRS or their insurance company or Social Security, and it's a federal program, they'll refer to us as SHIP, S-H-I-P. And if you're in the state of California and it's any state funded or state government agency program, they'll refer to us as HICAP, but we're both. And that's important to know because majority of people aren't aware that HICAP is the same as SHIP. And we are registered through the California Department of Aging. We're registered counselors. We go through extensive initial training and ongoing training. And we're actually the only authorized Medicare counselors in the state of California that are authorized by California Department of Aging. If you talk to someone who says that they're a Medicare expert or they're Medicare trained, pretty sure that it would be that they're an insurance or involved or selling insurance. They're not doing anything wrong. It's just a different perspective. They want to sell you a product. We want to advocate and educate. So if you see HICAP, you can really be comfortable in talking to them, knowing that there's no ulterior motive to sell you anything.
That's really good to know, Julie. And just so I'm clear, if somebody wants to register for Medicare or sign up, I guess, for Medicare, they're a new admittee, should we say, and they have questions, can they go to your agency and get help with that?
Yes, and that's a good part of what we do. We call them new to Medicare. So when someone is newly eligible for Medicare, could be because they're turning 65, or it could be because they're younger than 65 with a disability. So there are a lot of different people that are that could become eligible, and it's confusing. And especially to coordinate with other coverage, employer coverage, Veterans Administration, Medi-Cal, things like that. It's confusing because they want to know how to coordinate. They don't want to end up being penalized. So they can call us, and we actually have a counselor who meets with them, goes through everything so that they know what to expect and have all the pieces to the puzzle so that they can make good decisions on what they sign up for. It's very important that they contact and speak with somebody ahead of time, because it does happen to some if they don't and they end up with penalties, and the penalties can get pretty expensive over time.
So Julie, is there a cost for this service?
No, there's never a cost. We are fortunate. We do not ever charge for anything. We mail you, you ask us to mail you something, you ask us to do a presentation for you, ask that we meet with you, we give handouts, whatever it is that you need. We don't ever charge for anything. We don't sell anything, and we don't charge for anything at all. We're fortunate to have, like I said, state and federal funding. In addition to that, we have 27 counselors in the 2 counties, and all but 4 are volunteers. So we're very fortunate to have the high caliber of counselors that we have, and we're able to enjoy not having to have a huge budget to cover the cost of them. I always tease them and say that we could never afford them. So we're very fortunate they are volunteering. And we do have 4 staff people. We're based out of Santa Maria. And if you call, you will get a counselor. Anyone who picks up the phone is a registered counselor, can help you. If you have a quick question, something 5 minutes or so, we help you right then and there. Or if you need something mailed to you, we help you right then and there. Otherwise, we can schedule an appointment with a counselor either in person in your area. We have 13 counseling sites, or by Zoom, or by phone, whatever's convenient. So we try and help people get the information as as quickly and as efficiently as we can. We try and work with what we call clients, beneficiaries, to make sure they get the information they need.
This is a wonderful service, Julie. And there's also something called the Senior Medicare Patrol, or SMP for short. Tell us about that and how HICAP is involved with SMP.
Okay. SMP, which stands for Senior Medicare Patrol, has been around for quite a while. Our HICAP is recently partnered up with them. And so we're really excited about it. But SMP, what they do, one thing and one thing only, they help prevent Medicare fraud. They help people who feel that they were scammed, or help people with questions about it. They educate. If you have a situation and you call them, you think you were misled and there's a situation of fraud or a scam, they can help. So what we did is we partnered with them, and we're being trained by them. So you can also get a hold of HICAP for the same situations, and we can help that way. We've always helped with scams, and we've always helped with people who felt that they maybe were in a situation where there was fraud, but we would many times have to refer them to SMP because we were not trained as well. But now we are receiving the training from them, and we are actually part of SMP as a partner now. So we're really excited about that.
And is SMP also a governmental agency, and is there any charge for their services?
No, there's not. They actually are funded. The organization is called California Health Advocates, who has that state contract, and they're part of California Department of Aging as well, receive funding. They do not charge for anything. It's 100% free to anyone who calls. The goal is, again, just to advocate for people and to help people who think that they might be in a situation. A lot of times when I find that when I'm talking to someone and they were, scammed, and I said, well, why didn't you report it? Well, it's embarrassing. It's very embarrassing. Or I don't want my family to be mad at me. My kids are going to be so mad at me when they hear. So I always tell people they can contact us. We're not going to shame them in any way. Everybody's human. We all are susceptible to it. And if it wasn't so successful, there probably wouldn't be as many people trying it. So we don't want anyone to feel bad if they do fall for scammers, tricks or whatever. And we definitely don't want them to feel embarrassed. They need to speak up. We can help in many ways. And I know that we can help them individually, but we can help others as well from being scammed. And it's really very important that they do report things so it can be researched and taken care of.
So Julie, I wasn't even aware until very recently of SMP. So I wouldn't have known who to contact if I had a question about whether or not somebody was trying to scam me vis-a-vis my Medicare. how do people contact SMP and how would people know about it? Is this something that's advertised anywhere?
Well, SMP has been around, like I said, for a while. They want HICAP as their mechanism to get the word out. So they rely on HICAPs to do that. And like I said, we just recently have signed up to be part of that. So you're going to hear in our area a lot more because every counseling session gets paperwork on SMP. Every presentation we do, we mention it. But if someone wants to call them directly, they can call it in California, 1-855-613 7080. And if you don't happen to have that handy and you want to call, you can always call your local HICAP. And we are, like I said, affiliated with them, partnering with them. And you will hear a lot more about SMP in the future since we are going to be working with them to get the word out.
Wonderful. And I'm going to repeat that number, 1-855-613-7080. Is that correct?
Yes.
Good, good.
And they're part of the California Health Advocates, which is an organization. So
good. Good to know. So I mentioned in the introduction that this is now Medicare Annual Open Enrollment. Tell us about that. What happens during this particular enrollment period?
Okay. For most people, because there always are exceptions, but for most people, this is the one time a year that they can make changes in their Medicare coverage. It starts October 15th and ends December 7th. And any changes you make during that period will be effective January 1st. So during this time, it affects your prescription drug plan, Part D, and or could affect your if you have a Medicare Advantage plan like an HMO, PPO through Medicare. And so it's really important to get that information and make sure that you know what's going to happen next year. Every year there are a lot of changes. We did find out that Part B premium did go down about $5, but that's better than going up $5. There are quite a few prescription drug plans. There are 25 in the state of California that you have available to choose from. Many of them are going up. There's one that has doubled, and there's many that have gone up 50%. So what we suggest during this time, and you can contact HICAP, we help you, we put your prescription drug information into Medicare.gov, Plan Finder they call it, and it comes up with the 3 most economical plans. And if the current one that you have comes up as the top 3 and you're happy with it and you don't want to make a change, you don't do anything. And you at least know for the next year you're safe. If it doesn't come up as the top 3 and you want to make a change, save some money or get better coverage, you can do it between October 15th and December 7th. Sign up for that new plan. You're automatically disenrolled in your plan starting your old plan starting January 1st. I do have a lot of people who will tell me, no, nothing's changed. I'm fine. I have the same drugs I've had for 5 years. I have prescription drugs. I don't need to do anything. But you may not have changed, but the plan may have changed. And we always have people in January who come in and say, I got a bill. They took out of my Social Security check, instead of taking $24 out, they took $48 out. And there's nothing they can do for a year. They've basically committed for a year. So it's really important to, if you have a prescription drug plan, a Part D, to check it. If nothing else, you find out the one you have is still the best one for you and you do nothing. But it's also the time if you wanted to look to go from what's called original Medicare with a prescription Part D to a Medicare Advantage plan, which is traditionally an HMO. And you have the option of going from original Medicare to Medicare Advantage plan, or Medicare Advantage plan to another Medicare Advantage plan, or Medicare back to original Medicare. So there's a lot of questions and things going on, and there's pros and cons of doing that. So if you make an appointment with a counselor, they can walk you through it. A lot of times when you're on original Medicare, they'll say, oh, I want to switch to a Medicare Advantage plan. So we check the doctors, we check the prescriptions, make sure your drugs are still going to be covered at a reasonable price. And if that all goes well, then we talk about, well, what happens if you don't care for that and you want to go back? Are you going to be able to go back? So we kind of walk you through the whole process. We don't make decisions for anyone. We don't persuade you. We don't try and even attempt to try to tell you what's best for you, because we don't know what's best for you. I always just tell people, I just try and give you all the pieces to the puzzle so you can make a comfortable decision. And in most cases, the decisions you make, they stay with you for a year. So it is important. And that's what's going on at that time. There are some exceptions, but for the majority of people, that is the time that they can make changes in their for their coverage. And it's very important that they review it and make sure what they have is okay.
So Julie, tell me again how you would check your drug plan and see if it's the best one for you. I think you mentioned a way where you wouldn't have to necessarily call HICAP.
Right,
Yeah.
right. And
How would one do that?
if
Yeah.
you go to Medicare.gov and you click on the plan type finder tool, you can do it on your own. And it's easy. It's actually pretty easy. You punch in your information and you do what you need to do. And then they print out the results. The problem that some people have is they don't understand how to read the results.
Okay.
And so that's where, you might have an issue, and you can call us and ask us questions about that. Each year, it's more user-friendly, and so you can do that. But we do about 2,000 a year during this period of time for the people in San Luis Obispo and Santa Barbara counties, because they're like, hey, it's just so much easier to have you do it. You print it out. We just give you the information, you process it, you print out the results, you mail them to us, you answer our questions. We don't have to worry about entering in a mistake. We don't have to worry about reading it incorrectly. There's a new situation going on. If you take insulin, the information may not be, this year may not be exactly correct. So they've instructed us how to make some adjustments, but I am assuming that they're going to have those instructions on the plan finder for everyone else as well. But, either way, like I said, we don't require anyone to do that with us. We just offer that as a service. And for many people, they prefer to just have us do it.
That is a wonderful service because it can be quite confusing and quite daunting, especially if you're not particularly computer savvy. But this sounds like something that I'm going to try myself and then see what comes up. And if I need help, I know who to call.
Yeah, and if you have
So-
questions about it, we're available. I mean, we don't say, oh well, you didn't have us do it, so we're not talking to you.
Yeah.
If you have a question about how to understand the results, honestly, the people who call us many times, if we didn't do it, they're having problems with because they actually made a mistake on entry.
Yeah.
So that's another issue they have to, the old saying, garbage in, garbage out. So
Exactly. So, Julie, are there things that Medicare beneficiaries should be aware of during this period of time so they won't be taken advantage of?
yeah, I'm going to talk about real briefly some of the scams that go on at this time, because everyone is kind of, talking Medicare, and everyone's a little confused. They're a little bit anxious about making the wrong decision. So sometimes you'll get a call or a text or email, whatever, from Medicare. Okay, if you get a call from Medicare, it's a scam. Medicare does not call you. The exception to that, obviously, if you call them and you say, hey, can you give me a call back? They're going to call you, but they don't randomly call you. And usually these calls are saying, hey, we're trying to work on your plans for next year. Can you verify your Medicare number? Can you verify your bank account? Which I don't know why you'd need that. Can you verify this information? And a lot of times people think, oh my gosh, if I don't give them this, I'm not going to have any medical coverage next year. So they give it to them. And so just be aware, Medicare will not call you. They don't do that. IRS does not call you. Social Security does not call you. If you get calls like that, they are a scam. And I do suggest that if that happens and you for some reason think it's valid, get a phone number and say, let me call you back. And usually it's either an invalid phone number or they just hang up on you. My suggestion is if you get a phone call that doesn't look familiar, don't even answer it. But that's the scam part. Then there's other things going on, which is not illegal. It's just can be misleading sometimes during this time of year. A lot of advertisements. This is where insurance companies and insurance agents probably make more money in 3 months than they make the rest of the year. So it's a big time, and everybody is kind of wanting to go after that client, that person, that customer. So they're getting a lot of advertisements. They're getting a lot of phone calls. Majority of agents, insurance agents are just fine and they're decent people. But that handful are the ones that make me very nervous because the commissions for Medicare Advantage plans are very large commissions and they can make a lot of money by signing people up. The plans are good. There's nothing wrong with a Medicare Advantage plan at all. Those are very good options for people who want to give that a try. There are some limitations, but overall they're good plans. But as far as the way that some insurance people would approach them is a little bit unethical. They kind of give them bad information, get them to sign up. Then they end up being bumped out of their current plan, and then they can't see their doctor, can't get their medications. And they call us and we try and get it fixed. And if you ever have that happen, you want to, get a hold of us before December 7th. In some cases, if they sign up for something and it goes into effect in January and they don't meet any of the other criteria and we can't prove fraud, they basically are stuck with that for a year. Well, there's a period of time they can make a change, but they may not be able to get back to their situation they had before as easily as they had thought. The other thing is they're offering the world, you can have this, you can have this, you can have this, especially the advertisements on TV. And on very, very small print on the very bottom, it says may not be available in all areas. And in most cases, they're not. So they're going to tell you everything that's possibly available with this plan, but it may not be available in your area. So those are the things. If I always offer this to people, if you think you want to sign up for something and you have a salesperson, something on TV, an ad in the paper, whatever, and you're thinking this might work out well for me, you can call HICAP and we'll tell you the pros and cons of that plan. We don't have any reason to not tell you the pros and cons. We won't try and influence you one way or the other, but at least when you call HICAP, you're getting true information that is truly unbiased and in your best interest. So we offer that to everyone. And sometimes we get the people who will say, oh, well, they told me I had to sign up right then and there, or the opportunity goes away. Those are the people you need to run far away from. Just stay away from those people. Unless it's December 7th, you don't have to make a decision right then and there. But just be, they always say, if it sounds too good to be true, it could be that it's not true. And if you ever have a question about the validity of what a salesperson is telling you, HICAP will be there and we can answer that question for you.
That is really good advice, and it's advice that we give often on this particular show, Scam Squad, because anytime somebody tries to pressure you into making any kind of decision, back off, slow down, take your time, call another resource, investigate what it is that you're being told. Don't make a quick decision, because that is a big red flag. And often the person who's trying to get you to make a very quick decision does not have your best interest at heart. So I think it's really good advice for anybody who is interested in taking a insurance salesman up on one of these Medicare Advantage plans to, first of all, just stop and call HICAP and find out if there's anything in the fine print, if there's anything that they need to be aware of before they make that very big decision. Because to be stuck with something for a full year and all of a sudden not be able to access the doctors you want to access, or having to pay a larger amount of money for your drugs, that can be a very, very long and expensive and uncomfortable year.
And if you do find yourself in that situation, again, call us here at HICAP. There are some special situations, what we call special enrollment periods, where we may be able to get you out of a plan that you don't want to be. So if you did say, oh, well, there's nothing I can do about it, it's January, I'm stuck for a year. No, go ahead and give us a call. We may be able to find some situation that happened that qualifies you to make a change back to what you had.
And I think, Julie, I just want to mention those ads that you're referring to. They're very enticing because they do sound like, oh my gosh, I could get this and I could get rides and meals and so many things. But it almost sounds like it's coming from the government rather than from an insurance company, because they don't name the insurance company and they often have a celebrity endorser. So it's confusing.
Yeah, and they do that on purpose, obviously.
Yeah.
But when we get people to walk in with something and they said, I got this in the mail, looks official. And at the very bottom, it says not affiliated with any government agency. And if you read, if you can get close enough to the TV screen quick enough, you'll see that at the bottom as well.
Right.
But one of the things, you know, as far as these ads, you have to really be careful is that they give a number and it says, hey, especially throughout the year, hey, are you getting everything you're entitled to? Call this
Right.
number so we can see. Well, basically what's happening is they're like a broker where they're selling your name and your information. You're given permission to, by calling them, to maybe 50 different agents in your local area because they're not local. So within 10 minutes, you'll get bombarded with phone calls and you'll get 50 different agents calling you, trying to sell you something. Same thing where, so if you call, you get something in the mail and they say, call this number. Same thing. There's actually in Santa Barbara now, there's a storefront that they are selling. You walk in and they sell you Medicare products. There's actually a storefront now by La Cumbre Plaza, and they call themselves Medicare experts. Come in here and we'll get you the best deal you can get, as if they're advocates for them. Now, they're not doing anything illegal. They're not scamming you or they're not, you know, defrauding you, but they're selling you products. It's their goal. It's a storefront and their goal is to sell you something. And I've had a couple people call me and say, I went in there to see what my options were, and all of a sudden I had a different plan because they got confused. So I'm not trying to imply they're doing anything illegal. They're not. It's just their method of selling Medicare products. So you just have to be aware when you go in. It's like you go in to buy a car at a dealership. They're going to try and sell you a car. It's kind of the same thing.
This is so valuable, this information, because I've seen those ads on TV too, where somebody's saying, oh, well, now I can get this service and this service and this service that I didn't have before. But again, you don't know what the fine print is, and you don't know what you're going to be giving up to get those additional services, which may not be as important as the basic services that you're getting under your original plan.
Right.
So, I mean, to me, the best advice, if you have a question about your plan, if you have a question about either enrolling or changing your plan, go to HICAP, because they don't have any skin in the game other than just to help you pick the best plan for yourself. That's what I'm hearing from you, Julie, and I think that's the message.
That's 100% correct. And it is difficult when someone comes in and if they're stuck with it for a year, because, you know, it hurts us as well. So that's when we just start promoting our services even more, because we just want people to know that we can hopefully help people from making poor decisions. But again, none of the plans are bad. It's just whether they're good for you.
Right. Well, Julie, I so appreciate you coming on our show today and giving us this tremendously valuable information. I know that I've learned a lot. And I just want to thank you. Before you leave us, is there anything else you'd like to add?
No, I just make sure that HICAP is 805-928-5663 is our phone number. If for some reason you don't have that handy, just look up on the internet, just search for HICAP, Santa Barbara County, HICAP, San Luis Obispo County, whatever you choose, or any county in the state of California, and a number will come up.
Julie, could you repeat that number again, please?
Sure. Our direct line is 805-928-5663.
Julie, thank you so much. This has
Anytime.
been very, very valuable. And I know that our listeners will be happy to have learned so much from you. Thank you.
Sure, anytime. Thank you very much.
Julie.
Bye-bye now.